Well, thank you very much for letting me give a few final thoughts. To summarize, I think that as healthcare workers, we really do need to focus on not just ourselves, but also on all the workers in general. Many of the frontline workers need personal protective equipment. This includes food services, firefighters. You can go on and on of how many essential workers we have, yet we're running out of personal protective equipment again, even for just the healthcare workers. So this is really, I think, something that's entirely unacceptable in the United States. By this time, we should have had plants being devised and having manufacturing capabilities coming about to just manufacture this equipment for ourselves in the United States. Very, very important. Some of the themes from infectious disease authorities from various countries, which we heard this morning, were, I thought, very insightful. One of the take-home messages was that everybody underestimated this virus in the beginning. It just wasn't in the United States, both in its lethality and its infectivity. The virus itself may have mutated in England or in Europe, and so we may be dealing with a different virus than what appeared in China, one that is possibly more infective. But nevertheless, as recommendations changed, the public in Europe bought into these recommendations. The one slide that really struck me was from the Netherlands. It showed empty streets when they had the close down orders. In many parts of the United States, this was not the case. We did not have good public buy-in. So as we learned that the virus was more lethal and more infectious, and public health agencies in the United States increased their recommendations to quell the spread of the virus, this change in recommendations was used to discredit our public health agencies and use it as an excuse to essentially do nothing, which makes no sense at all. If you think they're in error because they underestimated the lethality of the virus, then why lay down and do even less and use that as a justification? So it is very, very disheartening when you look at our response compared to the other countries. And we still have a number of coronavirus deniers who still think that this is the flu, there's not that many deaths, and we're not in a huge, horrible type of a situation. And I feel that there is no question that we need a change in infectious disease policy. And the COVID-19 virus was not the first failing of the United States to control an epidemic. In my opinion, one of the first was MRSA. And instead of learning from this failure, we repeated the same strategies with the hopes of obtaining a different result. The United States often uses a one-size-does-not-fit-all argument to justify not adopting national standards. And you hear this all the time. Well, they have to do that in Boston, or they have to do that in the Northeast, but we don't need to do it here in rural Kentucky. And as I said in my presentation, rural Kentucky was the one area that had a huge outbreak of the virus. In fact, it had the largest outbreak per capita for many months. So that is very disheartening. And this strategy might allow one to address an outbreak when it has occurred, that of doing specific resources in a specific region. But if you want to prevent an outbreak and to prevent spread, especially with a contagion that has a very long incubation period, you need a national strategy. You can't wait for it to appear, because by that time you've had weeks and weeks of community spread. So that, I think, is very, very important. And to me, I've always been confused on how recommendations can vary between facility types when it's the same pathogen, because the characteristics of spread and containment of that pathogen do not change with the different facilities. Granted, patients who are immunosuppressed or who have other compromising factors may well be more susceptible to that pathogen. But in the United States, in my opinion, the most susceptible patients and the most at risk are those in nursing homes, and they have even less standards and more relaxed standards than those in hospitals. So we do need a coordinated national strategy. Now, this is a quote that I think is very insightful from Dr. Hunter McGuire, president of the American Medical Association, and it stated, "One of the most important questions of our hour was quarantine. A difficulty in dealing with infectious disease in America was the rooted dislike to the curtailment of personal liberties of the citizens for the benefit of the people at large." He then went on to state that everyone representing every shades of political opinion should unite and demand Congress to pass laws that would enable the government to properly protect its citizens against disease, much like the power of the federal government to repel a hostile fleet or army. And I think these were very wise words. Unfortunately, they were said in 1893, and things have not changed much in the United States. In both MRSA and the 2019 novel coronavirus, we were not fully committed to the testing and screening of individuals. We still do not know the amount of MRSA spread in the community. Neither do we have the capability to do widespread testing for community spread of the coronavirus. We either do not have the will, or we do not have the testing capability and the will to get that capability. And as you know, there seems to be a way of mitigating the virus by saying, well, just because we do more testing. Very, very discouraging. In both MRSA and the 2019 novel coronavirus, we focused on hand hygiene as a prominent and primary strategy. However, as I've mentioned before, this is a backup measure for dangerous pathogens because these pathogens should not be on a worker's hands in the first place, and if they are, there is a failure of containment and control. And this strategy, and the primarily focusing on this strategy, has allowed an excuse to emerge to not put forth the proper investments into infrastructure, screening, isolation rooms, staffing, PPE, etc., to prevent the spread of a dangerous contagion. And hand hygiene, I believe, also was overemphasized in the beginning, as opposed to advising the public that they needed to wear masks, and preferably N95 masks. And we also mitigate the impact by stating that, well, COVID-19 is just like the flu. 99% of the coronavirus cases are totally harmless. And this quote has been stated by some members of our government that are in the highest positions, causing extreme mixed messaging. And we mitigate the epidemic because of the falling fatality rates, yet we're ignoring the disability that it causes from those who survive. And we also largely ignore the reason for these falling rates, that in the new treatments which are coming online of proning, dexamethasone, remdesivir, anticoagulation, antibody serum, and hopefully soon vaccines. So of course we're going to see a decrease in fatalities. But these patients have survived the infection. They are not recovered. If you are in the hospital and you've contracted the 2019 novel coronavirus, there is a high likelihood that you will have lasting healthcare effects, especially if you are in the ICU, and these are just now beginning to become reported, and more papers and more authorities are recognizing that this is a huge problem, which will exert a great toll on our healthcare dollars for the needed medical treatment and supplies for support of these individuals. And finally, closing with my favorite quote, because I do think if you remember anything, please remember this: if we do not change our direction, we are likely to end up where we are headed.